Welcome to Old Married Man Podcast. I'm your host, Act John, the Black Dr. Phil. This is episode 2, Menopause. I have a special guest with me today, and I'm not just saying that because she's sitting right in front of my face. I really mean it. She's kind. She's a teammate. She's a doctor. She's a surgeon. She don't just walk around the hospital, don't talk to me because I'm a doctor. She speaks to everyone. She talks to everyone. When she hear me out in the lounge talking my crap, she comes out and go, what's the topic? She gives her 2 cents, drops the mic and leave the building. We appreciate you, Dr. P. I call her Dr. P because I can't pronounce her last name. Without any further ado, I'm gonna let her introduce herself to you.
Hey everybody, so happy to be here with you, old married man, Jonathan. I'm Dr. Lourdes Pelaez-Echevarria, and that's why they just call me Dr. P.
That's why.
Because Pelaez-Echevarria is just too hard to say.
Exactly. Okay, we're gonna get right into it. You're a doctor.
Yes, sir.
You're a surgeon. You're good. I hear a lot of good things about you. Luckily, I don't need you yet. So we're gonna get right on in it. Dr. P, what is menopause?
So menopause is actually that stage in a woman's life when her period stops. Once those periods stop for a consecutive 12 months, that is considered menopause. So that's the point that we call it menopause. Now we talk about perimenopause, and that's the point where periods start getting erratic. They start getting kind of crazy.
Okay.
And that's because of all the hormone changes.
Okay, so how do we know if how does the person know if they're in perimenopause?
They don't. Sometimes they don't, because perimenopause can last for years. You can be in menopause or perimenopause for 10 years.
Wow.
Yeah, women have no idea they're going into menopause, which is the perimenopause phase, until their periods start getting crazy. And that might be the last year of the perimenopause. So the average age in the United States for menopause is 51.
Wow.
That's the average age. But it can happen anywhere from the 30s on up.
30s?
Yeah, some women can go into menopause in their 30s. And sometimes it's familial. Women that smoke tend to go into menopause earlier. There's other factors that can be involved based on, medical issues, whatnot, family, hereditary. Some families, they just go into menopause early.
Wow. So smokers are at higher risk to go in early?
Yeah.
Wow.
Smokers
stop smoking if you don't want to go into menopause. Wow, I didn't know that.
Yeah.
So let me ask you a question. Is there a test to find if you're in menopause?
Yep. There are lots of tests that can be done. When women go into perimenopause, it's because their hormones start decreasing. Okay, specifically the estrogen starts decreasing and the progesterone. And so usually menopause or female problems are dealt with by OBGYN doctors, obstetrics and gynecologists. They are the ones that tend to deal with girl problems,
yes,
women problems. And those people, those physicians will do tests like estrogen, progesterone, the luteinizing hormone. They'll check all these different hormones, and based on those levels, they'll be able to tell where in menopause or perimenopause the woman is. And that's really the best test, is to go to an OBGYN and get that done. But you don't need a test for sure to know. There are also home tests.
Wow.
And you can go online, you can get anything online these days, right?
Of course. Amazon.
Yep. Oh, we don't want to. But yeah, you can get anything online these days, and there are home tests. So home tests exist, and you can do those.
So what are the common symptoms of menopause?
There are like over 30 different symptoms.
But like, what's the top? Okay, get the top
So
five.
the number one is hot flashes.
I heard that.
Yep,
I
hot
heard that.
flashes. And hot flashes are just that. All of a sudden, for no reason, the woman feels like she's on fire. Literally, she's on fire.
On fire.
It's like the ears get hot, the face gets flushed, and they come on randomly. Like there's no rhyme or reason. They could just be sitting there watching television, and then all of a sudden they start flashing. And it's crazy because all these fluctuations in the hormones are kind of screwing up the body.
So what do a person do when they get the hot flash? What can you do? That's it?
So stand in front of the fan, go drink some water, do something to cool off. I mean, there really isn't a lot that you can do to, once you have a hot flash, like it's already happening, right?
Mm-hmm.
Like there's not a whole lot you can do to undo it. Right?
But you said fire. I'm thinking jumping in water. Now you say I'm on. If I feel like I'm on fire, I'm jumping in the water. No water.
Well, you can take a cold shower, sure. That'll cool you right off.
If you home.
Yeah, if you're home, but
Okay, I don't advise this if you're at a job. Don't go jump in the shower. Okay, but if you home, take a shower. Okay.
That'll cool you right off.
What's number 2?
So number 2 symptom. Sorry, I gotta cheat.
No problem.
I'm not a OBGYN. I'm a general surgeon, so I gotta think about these things because it's not what I do all the time. So sleep disturbances. And again, because of the hot flashes,
You can't sleep.
you can't sleep because you're in bed and all of a sudden you're feeling hot and you pull the sheets off.
You're on fire.
You turn the pillow over to the cold side, and you do all those things, and it's so sleep disturbances are common. The next most common thing, and I think this is what really kind of upsets couples.
Okay, I can't wait to hear this.
Is the vaginal dryness.
Oh my goodness.
And nobody wants to talk about this.
Okay.
But it happens.
We need you to talk about it though.
I got to talk about it.
Okay.
It happens because, when the hormones are whacked, all of a sudden it's not moist down there anymore.
No lube.
No lube. And then when you're intimate with your partner, it's uncomfortable because there's no lube.
Okay.
So a lot of women, when they're going through perimenopause and menopause, they don't want to be with their partner because it hurts.
Yeah.
It's uncomfortable. It doesn't feel good anymore.
Mm-hmm.
It hurts. So, the way to fix that is there's a whole wall of lubricants at Walmart and Target and all the other stores. Experiment with some lube and a little more foreplay.
Is it just that the lubrication, or is it the not getting wet, or it lowers their libido also when they're in menopause?
Sure. Well, the testosterone is also a hormone that women have. Men have more testosterone than women, but the testosterone hormone also decreases.
Ooh.
And so
that's not good.
That's the hormone that drives the woman's libido.
Mm-hmm.
It also drives the men's libido. And because you guys have more of it, then your libidos tend to be more active than ours.
Definitely. So that's what comes when the woman's like slapping your hand, get off of me. Her estrogen is low. Is that what you're saying?
Well, the testosterone's low.
Oh, the testosterone is low.
Yeah.
Okay.
So all of these different hormones fluctuate during that perimenopause period. And, they might spike, they might go down, but overall there's a downtrend. All those hormones are decreasing. And so the libido goes, the dryness happens, all those things happen.
Okay, what's next?
What's next? Well, there's like over 30 different symptoms of menopause.
Mm-hmm.
The one that is most concerning is decrease in bone density. Okay, and so when women go into menopause and they become post-menopausal, they have not had a period for 12 months. Okay, and that means none at all for 12 months. Because sometimes what will happen when they're going through that perimenopause is they'll have periods and they'll be like wacky. They'll be longer, they'll be shorter, there'll be a period in between. There's all this craziness going on, and then all of a sudden there's no period.
At all?
At all. For like 3 months.
No more pads?
No, well, you think.
Okay.
You're done.
Okay.
And then all of a sudden, 4 months in, boom.
Wow.
Another period. And so this happens, and it can happen for 2, 3, 4 years of that. And then finally, you have no periods for 12 consecutive months. And that's when you can say the woman is truly in menopause.
Okay.
So during that time, all those hormones are doing crazy things. The woman, it's kind of upsetting because I'm getting old, right? Like she starts thinking, damn, I'm getting old.
It's over.
Yeah.
It's over.
I can't have babies anymore. I'm getting old. And so you realize, I think from a psychological standpoint, it can kind of wear on a woman.
So it's both mental and physical?
Yeah, sure. Absolutely.
Okay.
Now,
can you expand a little bit more on the bone part?
Oh, yeah, we were talking about the bone. Again, because of the hormones fluctuations, it kind of pulls the minerals out of the bones, and so it messes up the calcium metabolism.
Okay.
And so because that gets deranged, then the bones aren't as strong as they used to be.
Wow.
And that happens over time. The other thing is the cholesterol. It kind of screws up the cholesterol. In fact, the bad cholesterol, the LDL cholesterol, goes up. You don't want the bad one to go up.
Of course not.
And the good one, the HDL cholesterol, goes down, and you want that one to go up. So, it messes up the cholesterol. You gain weight, you can have headaches.
What about the mood swings? Tell us about the mood swings.
Yeah, mood changes. Hormones. Hormones do all sorts of things to your body, right?
So is it like being a woman on a period time 10?
Well, I wouldn't say times 10, but it does, you do get the mood swings because of the fluctuations in hormones. And so hormones can contribute to mood. And so if all of a sudden you get this crazy spike in testosterone, well, she's going to be enraged, right? Because we know that testosterone can create rage, right? And that's why you get these crazy mood swings. All of a sudden, the estrogen goes down or goes up, or the progesterone, all these different hormones, they're no longer like, there's no steady stream, normal. It's all over the place. And so that's why you get the erratic moods.
So is there medication that you can take?
Yes, absolutely. So there's all sorts of different treatments for menopause. And again, I would tell the viewers to go see a doctor if they're considering medication. There are hormone replacement therapies, we call them HRTs, and we can replace those hormones that are being wacky and kind of help with the mood swings and the flashes and the irritability and the night sweats and the vaginal dryness. There's hormones that can be prescribed. Not everyone can take these hormones. If you've had cancer, like a breast cancer, you cannot be on a hormone replacement therapy.
Wow.
So that, there are people that should not be taking hormone replacements. And HRTs, hormone replacement therapies, are not totally benign. They can, if you are one of those people that have a high family incidence of uterine cancer or breast cancer, then the HRT can help contribute to you getting a cancer in the future.
Oh my God.
So it's not like a 1-to-1 ratio for sure, but there is a higher incidence. So, you sort of trade off, okay, the hot flashes for, well, I could get cancer. So not everybody wants to be on hormone replacement because they don't want to increase their risk of cancer, right?
Of course not.
So there's all sorts of herbal therapies and hypnosis and acupuncture and antidepressants. There's different things that can be done. And there's a whole, and there's treatments for bone loss also.
Okay.
There's Actonel, Avista, Fortical, Prolia, Forteo. There's all these medicines we give women to make sure they don't lose all their bone densities.
Now, will all women go through menopause? Is there some women who just won't go through this?
So the symptoms, right? The hot flashes, the mood swings, all that. Some women have horrible symptoms,
Okay.
and some women don't experience much of anything. Or if they do, they don't, it doesn't seem to bother them as much.
So in other words, you're saying some of the women will not have the symptoms, but they still will go through menopause.
Sure.
So it's impossible for a woman not to go through menopause.
Well, unless they die and they're still having periods. Yes.
Okay. Other than that,
women that live beyond the
you're going through this.
menopausal, you're eventually going to stop having periods.
Okay.
And if you're going to stop having periods, you're going to have changes in your hormone levels, and changes in the hormone levels will cause problems. Will give you, not necessarily problems, they will give you some symptoms. And different women have, different tolerances to those symptoms.
Let me ask you a question. How long do this last?
I told you 10 years. Could be 10 years of
10
symptoms. Yeah.
10 years.
It could, yeah. So the average is 51? So they could start having symptoms at 41.
Wow.
Okay. Obviously, it's not horrible symptoms all 10 years. Usually the symptoms are vague and nondescript, and you don't realize that that's what the symptoms are.
Mm-hmm.
The worst of it is usually like a 1 or 2 year period.
Mm-hmm.
And some symptoms last forever, like for instance, the vaginal dryness,
So that's not going away.
not going away. But there's other, there's hormone creams that women can use to help with that. And again, lube.
Lubes.
I highly recommend
And
it.
that's forever.
Yeah.
Okay, so what are the other symptoms like the hot flashes and all that? That's going to stop eventually.
Yes, that will stop. for
Okay.
sure.
Now, you can get pregnant during perimenopause, right? Is that correct?
Yep. You can. So you, like I told you, the periods, they stop and start. So you don't know when you're going to ovulate,
Ooh, okay.
right?
It's scary.
It is scary. Because before you had regular periods, right? Every month you knew, okay, I'm having my period, couple more weeks, I'm going to be ovulating. And you can kind of time it, right? If you're doing that. But when you start going through perimenopause, you
It's
don't
on
know.
and off.
Right, it's on and off, it's off and on. You don't know when you're having your periods, or you'll think, okay, my period's stopped, right? And it's been 6 months, I haven't had a period. You could get pregnant on that 6th month.
Wow.
Because you happen to ovulate. And that has happened.
Now, I'm trying to imagine what a pregnant woman is like while she's going through perimenopause. That must be a heck of a roller coaster.
I think that's another show. No.
That must be a serious roller coaster.
Yeah.
Up and down.
I'm sure it's, well, the thing is once you're pregnant, then that's a whole nother set of
So the pregnancy would
different things-
supersede.
Yeah, different things kick in.
Wow. Now, do you have any advice for men Now let me get this question out.
Pray.
You probably don't have that on your cheat sheet. Do you have any advice for men other than pray? Get on your knees and pray.
Yeah. So I think being understanding about it, and men are going through it too.
Okay, hold on. That might be another question
men
on
are
the show.
going through andropause.
Menopause?
Andropause.
Andropause.
Andro. ANDRO pause.
Okay, I'm gonna have to Google that.
Yeah.
I'm gonna have to Google that. When did we start going through that?
About the same time.
45?
Yeah. Yeah, the hormones start. So if you have a couple, the men's hormones tend to fluctuate with the women's.
Wow.
Yeah, and there's like research to show that.
So what about if the guy? Hold on. I got a good question. I think it's a good question. Men. My father, he married younger. Mm-hmm. My mother was 9 years younger than my dad. Mm-hmm. Okay, so this might be a good idea to marry a little younger because so you won't be going through it around the same time.
Right.
Right? Is that good?
Well, and again, like I said, the hormones kind of fluctuate together.
You mean no matter the age?
Yeah, no matter the age.
So it's kind of like two women in the same house, their periods start lining up?
Mm-hmm. Yep.
Wow.
Yep. Same thing happens. So what can men do? Keep up the romance, right? When you were dating her and she was young, she wanted to go to the movies, to the restaurant, to walk on the beach. You want to keep some of that still alive, and you want to be there for her.
Dr. P, are you saying that a movie will help with menopause?
I'm saying talking to your significant other about what you're both feeling.
Okay.
Okay. And just doing things together that you both enjoy.
Okay.
Like if you both hate movies, don't go to the movies, right?
Mm-hmm.
But if you both enjoy them, then, that's something, it's a date night, right?
Okay.
And it's hard when the kids are like kids, you got all that stuff on your plate. But every once in a while, you need to take couple time, right? You need to do a little romance. A little romance goes a long way.
So you got to take it back.
Yeah, you got to take it back, Women want to feel desired. They want to feel appreciated when they're going through menopause. Because again, mentally, we're thinking, man, I'm getting old. I don't have it like I used to,
That scares women.
Yeah.
I don't think men are bothered by that.
No, because as men get older, it's kind of like fine wine, right?
Mm-hmm. I'm agree with you on that.
They look better with time.
I think so.
Women, we start wrinkling. We need to put more makeup on, and it's and then you see some that are like doing Botox and all this other stuff.
Oh yeah.
Just trying to keep the youth alive. Keep themselves looking young. I think for women it's harder than for men.
Okay.
Because you never hear about the old man, that old lady.
Yes, you're right about that. You're right about that. Okay, now, before I let you go, I want you to expand a little bit on the man menopause. Tell me a little bit, because I'm not even prepared for this. I wasn't prepared for this. I think you're going to
have to do another one.
Just give me a little bit. Just to give me a little bit.
Well, just, again, just like women's hormones start decreasing.
Yes.
Same thing with men. Their testosterone levels. You hear commercials about low T.
Yes, I've seen those.
Same thing. Their testosterone levels start decreasing.
Okay.
Over time.
Okay.
Okay.
Do we get hot flashes?
I don't know. I'm gonna have to research
on
that. But
I don't want no hot flashes.
Yeah, but there are definitely mood swings.
Wow.
They're definitely, you hear about the grumpy old fart. You
Yes.
don't hear about the grumpy old 20-year-old, right?
No.
Okay, so.
Yeah. But see, I thought that was because the man is with a woman who's in menopause and he's grumpy because she's not lubed and she's not wet and she's not giving him any and she's acting crazy and she's on fire, so he's in a bad mood. I thought that was about. No,
probably not.
They going through say it again.
Andropause.
See, I noticed you keep looking at your notes. You must have really You really wrote that down. You had something to say about that.
Yeah, I had to bring that up because it's not just us, you guys, it's not just the woman, right? The woman's going through menopause, yes, but it's not just the woman's fault, right? We can't just say, oh, it's menopause and that's why she is how she is.
Mm-hmm.
It takes a couple to have a relationship, right? And
Yes.
and if
Do you think some women look forward to menopause? I mean, not I'm not saying being on fire and stuff like that, but I'm talking about no more period,
Oh,
no more worried about
heck
getting
yes.
pregnant.
Oh, heck yes, absolutely.
Because you start your period, average what, 8 to 11 years old?
The average age, I think, in the United States is 11.
Okay, so you start your period at 11 and it don't end till you 50?
40 years of periods.
That's a long time.
Yeah, that's a lot of maxi pads.
I would think some women would be kind of, besides being on fire, I think some women would be happy. I'm not going to worry about getting pregnant anymore. That's is that the only good part
No,
about?
I don't have to worry about putting maxi pads or tampons in my purse anymore.
Okay.
Because,
Plus buying them.
well, yeah.
Yeah, you don't have to buy them. Okay. So that's the only upside of menopause?
I mean, it's kind of nice because now you don't have to plan your sex life around the period.
Your period. Because you can just go on vacation.
Yeah.
You don't have to worry about that.
Yeah.
Now, I have a question that I have to ask. Now, I was told to ask this question by one of my friends.
Okay.
Do menopause change the odor of a woman's body? Now, before I let you answer that, I think most men who've been with a woman long enough, if you put them a blindfold over them, they could smell a wife, or smell a partner, smell a spouse, and know who it is. So you're going to tell me now, after all that, menopause is going to change her body smell?
Well, yeah, because again, hormones, pheromones, right? When we are walking around, we're giving off pheromones and hormones, right? And when they're all turned upside down during menopause, then yes, your native smell changes. Plus, hot flashes, they might have a little more odor because they're sweating more.
Okay. So they smell a little bit more gym-like. A little manly-like, more like manly-like.
Maybe, I don't know.
So it actually changed the odor.
Yep.
Now, you go through menopause, you go through this transition. Do the woman that you met, that woman that you fell in love with,
It's still in there.
okay, do she ever come back? This is the question for the men. I'm gonna ask this is the question for the men. Do that woman that you met, fell in love with, live in the house with,
She's still there.
No. What I'm asking, do she ever come back?
Well, you got to bring her back.
We need her back.
You got to let her come back. You got to tell her, listen, I'm here for you and I want you back and I want you to,
Okay,
be
we want her
happy.
back.
Yeah.
Do she come back?
I think she can come back.
She can come back.
Yeah.
So we just got to do a little bit more hugging, kisses,
Yep.
romance, movies.
Flowers every once in a while.
Okay, will Hennessy help?
Hennessy?
Tequila,
Tequila.
will that help?
I think, alcohol in moderation might
That might help,
help.
but that won't help with the lube thing, though.
No.
We have to just buy lube.
Yes, you got to buy lube.
Okay.
Yeah.
Dr. P, I know you busy.
Yes.
Before we start this podcast, you got some phone calls. You have some patients you have to go see.
Yep.
I appreciate you. It took us a while to even get to sit down.
Yes. it
Because
did.
you're busy.
Crazy schedule.
You're busy. And Dr. P, again, I want to say you're one of the doctors in here that you're approachable. You talk to everyone. You treat everybody the same. And I just want to say, listen, I applaud you because everyone don't do that. Everyone does not do that. The gentleman you just speak on the phone, Dr. Osborne, does that.
Yeah.
Dr. Chisholm does that. There's a couple. Dr. V does that. But you are one of the people who, like I said, you peek out that room and say, what's the topic? You jump in and you give your wisdom, and we appreciate you.
Well,
I just want to say thank you
Thank you for having me.
very much.
Thank you.
We appreciate you.